Hello everybody. This is going to be a very basic video wherein we'll be talking about different regions, like the 9 regions into which the abdomen has been divided into. Now the question is, why is the abdomen divided into 9 regions? Now this is for the sake of a differential diagnosis. Like, there are specific organs present in different regions. So if a patient presents with pain in that particular region, then it may indicate a defect in that particular organ in that particular region. So that is why the abdomen has been divided into 9 different regions, and it becomes extremely important for us to study these regions separately. Now let us begin our study on these regions. So how are these regions actually divided? These are divided with the help of two horizontal lines and two vertical lines. Now let's talk about the two horizontal lines first. The first line is a horizontal line passing through the L1 vertebra, that is the first lumbar vertebra. This is known as the transpyloric plane, also known as the adjacent plane. The second horizontal line passes through the fifth lumbar vertebra, that is L5, and it is known as the transtubercular plane. The transtubercular plane. So these are the two horizontal planes that we were talking about. Now you might wonder, why is it known as the transpyloric plane and why this is known as the transtubercular plane. To begin with, let us talk about the transpyloric plane. Transpyloric plane is also known as the key plane of the abdomen. The key plane of the abdomen, because it transits a number of abdominal viscera, one of them being the pylorus of the stomach, and that is why it is known as the transpyloric plane. Now if we talk about the transtubercular plane, there is something known as the tubercle of the iliac. There is something known as the tubercle of the iliac crest. Like if I show you the hip bone, this is the hip bone. This is the anterior superior iliac spine. 5 centimeters or 2 inches behind the anterior superior iliac spine, you will find this. This is known as the tubercle of the iliac crest. Now there is a tubercle on both the hip bones on either side. So this transtubercular plane joins these two tubercles on the iliac crest, and therefore it is known as the transtubercular plane. Talking about the two vertical lines, we have the mid-clavicular lines on either side. Here we have one mid-clavicular line and the other mid-clavicular line. As the name suggests, it divides the clavicle into two halves. So it is known as a mid-clavicular line. Now as you can see, we have got two vertical lines here and two horizontal lines here, and also we have got 9 regions of the abdomen here. So this is how the 9 regions of the abdomen is actually divided. Now let us start with the naming. This portion of the abdomen is known as the epigastrium. This portion of the abdomen is known as the hypogastrium. Since you have the umbilicus here, this is known as the umbilical region. The umbilical region. This is known as the left hypochondrium. The left hypochondrium, and this is known as the right hypochondrium. This is known as the left lumbar region. This is known as the right lumbar region. This is known as the left iliac fossa. This is known as the right iliac fossa. So there you go. We have our 9 abdominal regions in front of us. Now let us talk about the different diseases associated with each of these regions. Now for example, a patient presents to the OPD with pain in the epigastrium, burning sensation in the epigastrium, or a dull aching pain in the epigastrium. What will be a most likely diagnosis? Of course, it will be peptic ulcer. Why? Because the major portion of the stomach lies in the epigastric region only. The other diagnosis can be esophagitis, pancreatitis, or gastric carcinoma. If a patient presents to you with a pain in the left hypochondrium, it can be due to splenic abscess or it can be due to splenic rupture. Now, rupture can also produce pain in some other region. Which region are we talking about? Yes, it is the left shoulder, which is known as the curse sign. Now, if the patient presents with a pain in the right hypochondrium, then of course it will be an ailment related to the liver only. So it can be hepatitis or it can be gallstones. If the patient presents to you with a pain in the umbilical region, it can be early appendicitis. It can be early appendicitis or Meckel's diverticulum Lumbar region, it is due to renal colic or pyelonephritis on either side. If the patient presents to you with a pain in the hypogastrium, it can be due to some urinary tract infection or it can be due to testicular torsion. If there is pain in the left iliac fossa, it can be due to ectopic pregnancy or ovarian cyst, of course, in females. And the same goes for the right iliac fossa, except there is a classical condition where there is extreme pain in the right iliac fossa, which is known as the appendicitis. In the last part of the video, let us discuss the structures which are transected by the transpyloric plane. For that, you need to remember a mnemonic, which is please feed him some love tomorrow. Please feed him some love tomorrow. By this mnemonic, you will be able to remember the structures or the viscera which are transected by the transpyloric plane. Remember, it is a very important MCQ question wherein they'll ask you which among these structures is transected by the transpyloric plane, and you need to choose one of the correct options. So you need to make sure that you remember all the structures very well. Like one structure out of all the structures that it transects is very understandable, which is the pylorus of the stomach, because it is in the name itself, transpyloric, which means the pylorus of the stomach. So the first letter P means pylorus of stomach. Pylorus of stomach. Also, there is formation of portal vein and pancreas. That is the neck of the pancreas. Of course, the portal vein is formed behind the neck of the pancreas, so you can remember these two together. Like if you even remember one of them, the other one is easy to remember. Now, the alphabet F will tell you the fundus of the stomach. Now, the word H will tell you the hila of kidneys. Now, the alphabet S will tell you about the superior mesenteric artery. That is its origin. This again is a very important thing to remember. L will tell you about the lower end of spinal cord. And finally, the alphabet T will tell you about the transverse mesocolon. So here are all the structures and the viscera which are transected by the transpyloric plane, which might come to you as an MCQ, because this is a frequently asked question. So with this, we have come to an end of this video. Thank you everybody for watching.